Welcome back to Breakfast Television. Rich saw in a little bit earlier talking about exercising, and you start getting those little aches and pains that come perhaps from being at the gym, or you have the, cold and flu happen. But there are some signs that we tend to ignore that we shouldn't ignore. And Dr. Zach Levine is back on the show, of course, ER physician at the MUHC. Dr. Zach, welcome back. Great to have you here.
Good to be here.
And it's true. There are some things where, that are quite obvious and that we can take care of ourselves. But there are some things that we should really check right away that perhaps we just think, oh, well, that's no big deal. Let's start with back pain, first of all. We all get back pain, but when does it get to a point where we should see somebody about it?
So doctors have red flags, and you're right. People have really different thresholds. Some people come in for very minor things. They're very worried, and some people, they won't come in until they're at death's door. Yeah. So people are different. So back pain, what makes doctors worry is, number one, if back pain is associated with certain things. So if you have weakness or numbness in your legs, if you have trouble controlling your bowel or your bladder, those are worrisome things. If you have fever, if you have a history of cancer, all those things make us worry that it could be a worse kind of back pain. So whether the reason cancer, it could be maybe cancer is spread to the bone. If you're having the bowel and bladder symptoms and also the leg weakness or numbness, that says maybe there's an effect on the spinal cord, something pushing on the spinal cord, and that's something that's potentially a real emergency.
What are kidney stones too? Would you feel it in that area as well?
So that's it. It doesn't necessarily, so kidney stones, they're terribly painful, but usually they're not dangerous.
Right.
So it doesn't necessarily correlate to pain. The amount of pain doesn't necessarily indicate how dangerous something is. Now, having said that, if you're having terrible pain in your back, go in, get it checked out. Even if it's not something that's going to kill you, you need pain control.
Absolutely. All right, next is a headache. We all get headaches, but when does it become a concern for people?
Yeah. So the worrisome headaches are, there's a couple. So number one is something called the subarachnoid hemorrhage, which is a spontaneous bleed, usually spontaneous, in the brain. And the classic is what they call a thunderclap headache. So worst headache of your life that goes from 0 to 100 instantly. So you have no headache, and then suddenly you have the worst headache of your life. That's worrisome. Other headaches that worry us are if you have a stiff neck, if you have vomiting, if you have fever, because that could be meningitis.
Okay.
Yeah, and then if you have someone becomes confused or has a seizure or something like that, obviously those are warning signs that it's not just your typical headache. If you're someone who never gets headaches and you suddenly have a headache and it's not going away, get it checked out. Maybe not, you don't have to run to the hospital immediately, but if anything, anything that's not normal for you, get it checked out.
Okay. Next up is flashing lights, which I've never gotten, but I've heard it can be pretty scary for people to have this.
Yeah, and this is specifically if you have flashing lights in one eye. Some people do get flashing lights before, like a migraine or something, and those people may be aware of that. But if you have sudden flashing lights in one eye, especially if it's associated with vision loss, but even if it's not, get it checked out because it's one of the symptoms of what's called a retinal detachment. Okay. And a retinal detachment is where the very sensitive cells at the back of the eye sort of peel away from the back of the eye, and they lose, when that happens, they actually lose their blood supply and they can begin to die. And so that's actually an emergency, and it needs to be seen by an ophthalmologist as quickly as possible. So if you have that, get it checked out.
Swollen leg is one that, again, interesting that you might think it's nothing, right? But it could lead to worse things.
Exactly, yeah. So the swollen leg, the reason it's, if you injure yourself, you twist your ankle and your ankle swells up, it's normal. Yeah. You might want to get it checked out if you're worried that it's fractured or something. But if you have a swollen leg for no reason, especially like a swollen, painful calf for no reason, especially in the context of risk factors, what we're worried about is a blood clot, basically. Okay. You have a deep blood clot, a DVT, that can travel and that can go up to the lungs, that can be life-threatening. And the risk factors for having a blood clot are immobilization, so if you've had like a 6-hour flight, if you have a history of cancer, if you've been on hormone therapy, all those things increase your risk. So again, if you just have a painful leg and you just hurt it, that's one thing. But if there's no reason for it and you have one of those risk factors, get it checked out.
Quickly, blood where it should not be.
Blood where it should not be, yeah. So sometimes we ignore these things, but if you're coughing up blood, if you're vomiting up blood, if you're having blood in your stool, if you're having vaginal bleeding postmenopausal, so obviously if you're having your period, that's fine. Right. But postmenopausal or blood in your urine, these things are not normal. They have to be checked out. They could be cancer. That doesn't mean they are, but don't ignore them, especially if they're ongoing.
Excellent. Always a pleasure having you, Dr. Zach. Thanks so much for being here. Again, if you want to check out our website, btmontreal.ca, you can check out our blog section and find out more about some of these red flags that you should be aware of. We'll be back with more Breakfast Television right here on City.